Welcome to Leaders Digest at NBJ Summit 2025. I'm Fran Schoenwetter with New Hope and with NBJ, and I'm here with Mike Fortescue. He's the Executive Vice President of Mitsubishi International Food Ingredients. Welcome, Mike.
Oh, thanks, Fran. Thanks for having me. It's great to be back at the summit once again, and appreciate you taking the time to talk to me about Mitsubishi and the industry overall.
How has Mitsubishi evolved in response to some of the shifts in the science, the regulations, and consumer behavior since DSHEA, which is a long time ago, but there's been a lot of changes. How has the company responded to that?
So when you talk about DSHEA, I mean, the industry overall looks nothing like it did when DSHEA came out, right? There's a lot more knowledge in terms of the customers, what they know about the business overall, what's happening in the industry. They're more informed. They're making good decisions. So for us at Mitsubishi, I mean, we really haven't changed much with regards to how we're approaching the industry, because we've always come from a science-backed knowledge of products. We bring products that are clinically backed with the science behind them. And so we've always taken that as a way to approach the market, to educate the market, and to bring high-quality products to them. So, in that way, we really haven't changed in terms of how we approach the market. That's our fundamental way to go to the supplement industry is, using science as the backbone. We are a distributor here in North America. We act as a distributor, but in Japan, we are a manufacturer. So we're manufacturing products, and then we're also distributing products here in North America and then globally. And then we have other partners we work with that are making products. But again, we're bringing clinically backed products. So anything that we bring on new to the market, we want to make sure that there's data driven behind that, that we're just not bringing something that is, the new fancy ingredient that everyone's looking at. We want to make sure that there's, a real reason to bring it to the market. We've been able to build a lot of trust with our customer base in that we're bringing high quality products that actually do something for you. We're not just making a claim and saying this is what the product does. We have the data that backs it up. And so that's allowed us to grow as a company by building that trust. And they know when we bring something new, they know that there's science behind it. And so that's really helped us in the industry as a whole.
Well, when we talk about transformation in health, how do you balance the innovation and the process behind innovation with the conservatism of science and the regulatory environment? If
you look at what's happening even today and how that's becoming more important to have regulatory behind it. I mean, if you don't have a pathway to bringing a new product to market with the regulatory and the science and all the data, then, ultimately you just have a science project, right? I mean, that's all it is. So you need to bring that awareness to the customer. You need to have the data that they trust you with. You're dealing with major brands in a lot of cases, and they need to be compliant. They need to have that regulatory behind them, that they know that the product is doing what it claims to be doing. So while we do look at innovative product, we want to make sure that there is science behind it and that it is meeting regulatory standards, whether that's FDA or somewhere else in the world, that we want to be able to promote that product, that we're meeting those standards in those countries that we want to bring the product. So consumers
have high expectations, but they also have misunderstandings about dietary supplements. And when you're prioritizing the quality that Mitsubishi provides to your customers, what are your thoughts about how they can communicate that to the consumers to meet their expectations of effectiveness and safety, of course?
We try to do that as best we can, work with the end user as much as possible to give them, not necessarily buzzwords, but give them different ideas of what the product is actually doing and showing them in the data where that is coming from, and then how do they take that and promote that to the marketplace, whether it's from cognition, gut health, beauty from within, any of those things. Because, in Japan, a lot of the products that they're not, you look at supplements here, a lot of times it's a pill. It's changing a lot here now. But in Japan, a lot of it is, it's in a drink, it's in a beverage, it's in, something that they're ingesting, as opposed to really taking a pill. They prefer to have it in a different format. So we're able to take that knowledge from different places in the world and then bring that to the North American market as another way to either ingest the product or to use the product. And that's really helped us overall. And I think it helps the industry as well, seeing different ways that you can promote a product and not just in a pill format, right?
Right, meeting consumers right where they are and in the formats that they prefer. So does Mitsubishi, with all the great clinical backing behind the ingredients, do you provide DSHEA compliant information, supported claims to your customers? Because often the customer will translate what you provide to them to their labels and to the consumer. So how do you manage for that?
Yeah, we'll provide the the white papers, any of the clinical data that comes with it. Our partners in Japan as well are consistently doing new clinicals where they're able to take the big thing that we're doing now is we're looking at how some of the ingredients interact with one another. So not just a clinical on a single ingredient, but we're doing clinicals on our ingredients that are 2 or 3 different ingredients, putting those together and then try to put a clinical together on that. So how do they interact and give even higher performance and benefit the end user? So that's a focus of our products now.
Yeah, that's tricky. And it's complex. We also are seeing in the market quite a bit of pressing towards personalization. Where does that play in?
So for us, because we're not selling necessarily an end product, we're not a CPG company. We're not. So from a personalization standpoint, it doesn't really impact us so much from that standpoint of going to user A, B, C, and D and educating on that. We're relying on our customer to be able to do that and to be able to personalize. So as much information as we provide them that allows them to personalize their final product, that's only going to help them help the consumer at the end of the day. So the more clinical, more information we can provide to them allows them to give a little bit more personalization, customization for the marketplace.
Where do you feel that Mitsubishi International Food Ingredients can really have the biggest impact on the industry as a whole?
The biggest impact I think that we have is, as I said, we're a manufacturer and a distributor. So we're able to really get down and talk to customers on a different level. In some cases, we're talking about many, many ingredients as opposed to, some manufacturers where they're single focused on, one particular ingredient and how that product is used. We're able to talk about a whole host of different things, even on the food side of the business, and how people are taking nutritional products and putting those more into food. So we're able to pick up trends and provide that back to our partners, which then gives us the opportunity to grow the business further and then find new products that benefit the market. And again, we're bringing products that clinically backed. We're looking at that first before we're just bringing a trendy product to the market. We want to make sure that we're doing the right thing by the industry overall, and we're backing up what we're saying the product's doing. Because if you have products that don't back up what you say they are, that only hurts the industry overall, because you're just downgrading everybody else's product, because it impacts the industry completely. So.
And as we heard earlier here at the NBJ Summit, fads come and go, but trends grow and change. So I guess I would close here by asking you about trends and about how Mitsubishi really looks at trends and leans into that for staying power.
Some of our brands, our branded products, have been really resilient. We have a product now, Amino LP20, that prior to COVID, we didn't sell that much. COVID, we had a huge spike because everyone was worried about, health, gut health. So this is a probiotic. Then we saw that dip after COVID, and now we're seeing that really spike again, where people are being more informed, thinking about gut health, and the industry overall has really helped with that. So we're seeing that more as a trend than a fad. If you looked at it probably during COVID, you would say, oh, that was really a fad. But now it's come back where I think it's more of a trend than anything else. So I think just the fact that we have very resilient products overall, and we have the data to back it up, our products don't tend to be, in category as fad. It's more a resilient product. They take longer to maybe take hold, but then they can become a trend and stay for a long period of time. So,
well, it sounds to me like you're talking about a commitment to health versus a commitment simply to a short-term sale. Would that be a good characterization?
Yeah, I would say so. I mean, that's one of the core principles of Mitsubishi overall, right? They want to make sure that they're bettering society overall. So these ingredients that we're selling are really, fit that need for the market and for the, people in the world. So as I said, founding principle of Mitsubishi. So
thank you so much, Mike, for talking to us about your perspective on the industry. We really appreciate you being here with us today.
Yeah, thanks so much. I had a great time. Thank you.
And thank you all for joining us for Leaders Digest from NBJ Summit.